Well, Caroline, we got a special guest on today and a topic that sometimes can be, a little uncomfortable for some male advisors to speak with, but it's something we all need to talk about. And that is midlife women and perimenopause and menopause and possibly solutions that a lot of them might be looking for. Women make up more than half the workforce and are in vital roles in leadership more today than ever before, which is amazing. But so many women leave the workforce due to unresolved health issues potentially. And I'm so glad that we have Angela on today.
Yeah, most definitely. It's refreshing to see that the topic of women and midlife health is, so prominent and that people are willing to speak about it, just like we see on the mental health side. So I'm really encouraged by that. And I'm really excited to hear about the work and the research that Angela has done in the UK in bringing a solution over to Canada. So yes, there is more to the UK than the crown. And we're going to hear all about that.
And it's a solution that companies should be considering, especially if you want to modernize your benefit programs to meet today's workforce. So excited to have her on today.
All right, let's bring her in. Welcome, Angela Johnson. We're really pleased to have you as a guest today, and you're with SanoLiving. So first, tell us a bit about your background, and then we'll get into the name SanoLiving. I am curious about that. So yeah, tell us about yourself.
Well, it's great to be here, and I'm so glad you invited me. It's the more we can get the message out, the better about what's happening with women and this time of their life. So I have been in the space for, I would say now since 2019. I started my career at IBM. I became an IBM executive. And then out of my own personal family situation, I started a company called Medical Confidence, which some of your audience may recognize. We supported nearly every Canadian insurance company in Canada with the exception of two. And it was really about navigating the public healthcare system. And then we sold to what is now Kai, it was CloudMD at the time. And I took a year off. And after completing a year with them, and then I took a year off. And during that time, I decided I didn't need my hormone therapy anymore. And I thought, well, I'm not working. I'm retired. And I hit a wall. I hit rock bottom. I thought perimenopause, which is the time up to menopause, was rough for me. I thought that was bad, but boy, this was really bad. I was getting sodium hyaluronate injections because I thought the arthritis was so bad. I had severe depression. I barely could figure out what my purpose in life was and why would I need to get out of bed in any real hurry. And then it was my husband that suggested that maybe I want to go back and talk to my gynecologist. And so I did, and I got back feeling like myself again, and he encouraged me to maybe do this again and look at how I could support women. So back at it, what we did was we spent a lot of time in the UK. So United Kingdom has been at this women's health for more than 10 years now. I would say probably they've really been the leaders in the space for 12 years. So I went and spent a lot of time there interviewing providers, government officials, plan sponsors, employers, employees, group benefits advisors, all of them, asking, what did you do right? What would have you done differently? And I took those learnings as well as the learnings from Medical Confidence of healthcare navigation, because you can't do women's health entirely digitally. It's impossible. And then we layered in on top of that coaching. So when I was working at CloudMD and just in the transition of selling to them, we were working with Sun Life on a product called Mental Health Coach, which if you just Google Sun Life and Google Mental Health Coach, it is one of their most high value products that they're most proud of. And it really, it was also designed off of a UK solution, actually. And so I pulled in that element as well. And then we layered on clinician care. And so that holistic approach of lifestyle and clinician care and taking a more proactive approach to health was what we really set out to do.
It's amazing. It's amazing. Thanks for looking.
So,
Especially,
so
it's great to talk to a serial entrepreneur like us that are always looking for options in the workplace, and looking at women's health is absolutely a hot button in our industry right now, to say the least. That a lot of organizations are looking at, that unfortunately has not been discussed over the years past. So, talk to us about some of the findings that you went through when you first started SanoLiving, and the impact that SanoLiving's had on a lot of women that have been through your program.
Well, the knowledge came from the days of medical confidence. So from 2019 to 2021, that company was really focused on disability support. So when an individual is, a claimant, they're on claim, they are on long-term disability, or, have just transitioned from short-term into long-term, is where the majority of our work was with the insurers. And what we saw was this high propensity and high numbers of women in this age group, and really in the disability classifications of mental health. So, anxiety, depression, chronic fatigue, chronic pain, fibromyalgia, sleep disorders, all of these were the biggest claim volumes that were coming in. And then, there was also arthritis as well. And what was coming in that. So when you look at that data, and then you would see the age groups of it, you go, wait a minute, like, now that I know more about women's midlife health and the symptoms that women experience through a hormonal transition, and then the elevated risks that come with that for heart disease, osteopenia and arthritis, metabolic disorders, and genitourinary conditions and mental health disorders, you start to put two and two together and realize, well, wait a minute, there's no way that all of these are really these disability classifications of mental health. There could be a significant portion of these that are related to just the natural transition that women go through, but it's unmanaged and not really getting the proper care and support they need. And so that's when I realized there's a real value here to employers, to insurers, but ultimately to women who, they are taking a step back in their careers at a time when this is supposed to be their biggest opportunity, right? We have made huge strides in getting women recognized as being important stakeholders in the workplace. They are being offered promotions. They're being offered opportunities in the boardroom and in leadership positions. Yet here, we actually are recognizing, and we're seeing more data where women are opting out of those opportunities because they just are hitting this, I call it the trifecta. She's a home caregiver, so she's the CEO of the household. She has got a demanding career at this point that's going, in a trajectory level. And then on top of that, she's got probably a sandwich generation as a caregiver at home of kids plus aging parents on her side and her partner's side, because it does typically land, and the data's there, it supports it, that it typically lands on women's shoulders.
Oh.
So she's got this trifecta along with this impact in her health. And she's like, I'm not myself anymore. I used to be the rock star. I was the one that could deliver it all at work and still manage everything at home. And now I'm just burned out. I'm disengaged. I'm not delivering, and I know I'm letting my team and my workplace down, and then it's impacting me at home. So then they sit there and they reflect and say, well, what can I do about it? And the one lever they can pull is work. So they pull the lever of work and they say, I'll take a step back. I will leave the workplace entirely. I'll go consulting. I'll define my own hours. I'll go part-time. I'll pass on the promotion. And there was a great study by HER BC that BC Blue Cross sponsored. Fabulous report about how women are saying, 1 in 10 are passing up on a promotion. There was another report from the Menopause Foundation of Canada that said 1 in 10 are leaving the workplace as a result. So employers who are sitting here going, I don't have enough talent in my workforce, and then they look and they actually dig into the data and see how many women are leaving. We have, the McKinsey report of 2023, I think it was 2023 or 2024, reported that for every female that is promoted to the director role, 2 are leaving. So we have a depletion of talent, of leadership talent, of women that are in this space that we desperately need in the workplace. So what we need to do is not create policies. And this is one of the big learnings that the UK gave me is we started with policies and accommodations. And all it did was drive an underground behavior of women, because the last thing they wanted to be was labeled with the big M word of being menopausal and incapable of being at the top of their game and being accommodated. Because setting up accommodation, she's no longer in the workplace full time. She's being perceived as not capable. She's not there all the time for those leadership opportunities, whereas her peers may be, her male peers may be. And so she's looking at it saying, well, don't label me. I'm more than capable. I'm not that, right? And so it created an underground behavior that, just left women further unsupported. And so what they said is what we should have started with was just health solutions. Equip her with good quality care that she can opt in and use and not have to pay for, because there's a big challenge of that in our system where, we see more and more of these solutions popping up, but women have to pay. If it's included in workplace benefits, women can use it and leverage it. And we know women are the biggest users of their benefits, far more than men. It's well documented. So let's give them the solutions they need so that they can get on with the job, feel fantastic, feel like themselves, thriving, and will outperform day after day for their employer.
So, Angela, you've just identified a few key points, if I can recap. So, number one, this is an urgent issue in the workforce. So employers trying to gain talent. But as I heard you talk about, women, leaving the career during midlife because of, 1 in 10, that's going to have a financial impact to Canadian women out there, not only from the gap prior, if they may have taken time off to have kids and be off work for a bit, but coming back in and then having to depart again. So, that war for talent is on, but also a financial impact when it comes to retirement and savings, I can imagine. Did anything pop up in the UK on that note?
Well, actually, if you look to the US, the Prudential Insurance put out a study last year that cited that women are retiring 1/3 of the net worth of men. And then if you layer in, I think they also noted, no, it was Pay Scale that noted that women's peak salary is at 44. Men's peak salary is at 55. And we have, you look at Stats Canada data, there's a 53 or 54% gap between men's peak salary and women's peak salary. So you add in the 10 years that women's peak salary is at 44. You add in that, 1 in 10 are leaving. And then that compounded interest effect on top of that. And then layer in on top of the fact that women live 5 to 7 years longer than men, but 25% of that is in chronic illness, debilitating chronic illness. So she's living longer. She's got more care needs than a male does, but she has less wealth to get her through it. So we have a real challenge for women. I'm sorry, ladies. It doesn't sound very good, does it? But
I'm looking for the bright point.
Right. And I was going to say, especially, with the analytics that we all do as advisors from a benefit plan standpoint, there's more midlife women in fantastic roles and organizations than ever before, but it's absolutely an underserved segment from a benefit plan. And I can tell you, being in out of benefit plans for over 25 years now, that there really isn't anything designed around women's health and benefit plans traditionally. So Angela, from your side, what are a couple like quick ideas or points that you would recommend to organizations if you were designing a benefits plan specifically focusing on the key important areas of women's health from your background and from all the studies that you've done?
Well, I think the key thing is that you have to look at not just on, menopause hormonal health, but you need to have a solution that's holistic in its approach. So is also focused on the longevity and preventative chronic illness risks. So that's key because you address those things, you're going to keep her in the workforce healthy and fit. And you're not going to have this higher incidence of disability rate and claims, and having to replace her yet still pay the disability claims out. So you've got the lost talent plus the double whammy of the disability claim. So you need that holistic approach. It can't just be one solution. You need more of a looking at her, from all aspects of her health. And when she shows up in her GP's office, if she's fortunate enough, they are not having those proactive conversations. They're not looking at, let's get your baseline data and let's figure out and assess your risks. Manage obviously your immediate symptoms that are bothering you, but also let's set you up long term for managing the risks and preventing it long term. And so that is health coaching on lifestyle stuff, which hard to do on your own, really hard to do. So anybody that's tried to lose 10 pounds and do it on their own knows it's a tough slog. And to stay consistently doing that is really tough.
Yeah.
So a health coach who's really trained in how to support you and cheer you on and modify maybe lifestyle changes that suit with your lifestyle, because a coach can come with the best intentions, but if it doesn't work in your life, you're not going to stick with it, right?
Yeah. Yeah. Well, and this is also, I think, important, is leading into what SanoLiving does. Is, I'm watching the ball game last night, and I can't remember what it's called. I think it was called like My Rocky or Rocky Me, and I was like, I had to Google it. I'm like, what is this? And it's a lot like there's a lot of those online, uh, organizations, companies out there that men can buy stuff for ED drugs or hair loss or weight loss, but nothing is focused around women's health. And I've watched it where so many women that I know can struggle in these midlife scenarios, and they don't feel like they have any options. So I think this is where, I'd love our audience to learn a little bit more about what SanoLiving can do for organizations and companies.
Yeah, and then you got to layer in on top of those lifestyle elements, the clinical stuff. So sometimes it's proactive preventative care and just monitoring risks, but other times you may need medications for management. We layer that in on top. So, and that's the ongoing care and proactive, but also management. And that may look like hormone therapy. It may not be hormone therapy. It may be other medications. It could be anything. Or it could just be running, bone scan tests proactively, or blood work proactively, and having a real consultation about what that means. Because sometimes we walk into our doctor's office after going to the lab and getting blood work, and they go, yeah, all good. But you never really know what was, the interpretation of what was said. So going through it with you, helping you understand it so that you're empowered to make good choices. Because the more educated and informed we are, the more invested we are into the lifestyle changes that we need to make sure that we're set up for success downturn. Another thing is cancer survivorship. That's another thing that is big for women. There's a higher incidence rate of women with hormonal positive cancers, and it will immediately put them into menopause. And it's
Mm.
an automatic induced menopause and helping them understand their choices around medications and managing that. Oncologists, they are trained 100%. They're to mitigate the risk of reoccurrence of cancer, but that can also come with increased risk in other conditions as a result of those treatments. And women aren't being fully informed about their choices about what to do. And the choices that they're being given from an oncologist are not fully informed for them. And so we work on those things as well for women. That's also a biggie.
So, SanoLiving, tell us about the name. I want to focus on that, and then get into what you do to help women out there in midlife.
So sano in Latin is healthy, so healthy living. So really focusing on that holistic approach to health and that longevity side of it.
Mm-hmm. Good, makes sense. And so, what is it that SanoLiving can do to help women? And is there an employer aspect to your offering as well that fits into the benefit package?
Yeah, so I'll start with the latter part of your question first. So definitely, my passion and commitment is that it should be included in every workplace benefit, at least some solution that's like this. And I don't want it to be another tampon tax. And women also are looking, like they already have enough additional costs in appearances and staying, looking good and all that. So adding this on top of it is just another thing I just don't want women to have to pay for. So by bundling it into benefits, that's a real key. And, for some employers, what they're doing is they'll put it in for their whole employee because, there is the risk that some women will experience this much earlier, as an example, cancer patients. So what some employers will do is put it for all female employees. Some will put it for all employees and their dependents. We have one employer who is in the oil and gas industry, heavy male dominated. I think 80% of their employees are male. But what they recognized was when their partner is not well at home, they bring that to work. And in their industry, they need their employees 100% focused and on the job because there is the risk of occupational health challenges on the job and whatnot. So they've opted to give it to all their employees. And then we have other employers that just say, I'm going to give it from 40 years of age and up for my female employees. So every employer has a different strategy of how they're making it available. And what it includes is it's an online digital health platform where they come in, they do an assessment, it identifies based if what they're feeling and experiencing could be connected to a midlife transition, identifies where they would be in the midlife transition for women, and then it gives them an opportunity to set goals and then book with a health coach. And from there, their health coach supports them through the entire journey and focusing on the lifestyle interventions, giving them diet plans, all that, and working with them on an ongoing basis via chat, but also like this, one-on-one, and in group sessions as well. And then they have access to libraries of podcasts and webinars and articles and anything you name it, like from an educational empowerment standpoint. They can do course material and work through those if they want. And then there is peer groups that they can chat with peers on different topics. They can post a topic or a question and ask others how they're coping with something. And then coaches and clinicians can weigh in if they're asked to come in and comment on a question. And then on top of that, they're paired with their clinician who is licensed in their province and can order requisitions, and can prescribe and can refer to specialists if needed. all of that. And then that's their care team, and they can add in a dietitian or a naturopathic doctor if they like, or all these other supplements can be added on. But the core base service is all that technology, their coach and their clinician. And they stay with them for the year, and they can renew each year if they want. We have several women that continue on every year.
And this is great, Angela. And I'm finding, specifically because your program is so targeted, what kind of results can you share with the audience? Because you shared some numbers with Caroline and I, and we were really impressed with kind of the impact that SanoLiving's had.
Yeah, so we've been around now more than 2 years. So we've had thousands of women come through, which is great. And when they're in their care plan and they're working with their clinician, they come on and they do that initial assessment. So that's considered their baseline data. And then as they undergo their care plan and work with their coach and their clinician, they reassess a couple times throughout the year. So from the baseline data to the reassessment data, we published a white paper of the thousands of women that have been through the program already. And it's up on our website, and I encourage anybody, you don't even have to put in your contact information to get it. You can just go access it.
We'll share all that information in our podcast notes.
Thanks. And so women are reporting 80% improvement in their severe to moderate symptoms. They're reporting 50% improvement in their ability to perform at work. So, and then I think it's 71% improvement in their mental health. So anxiety and depression symptoms, seeing improvement there.
It's amazing.
So it's compelling. And what also is interesting is that it's sustainable. It's not a one and done, I reported, and this is how I feel at this moment. This is over the course of a year in their program, they're reporting that this is how they're feeling. So it's not like, oh yeah, you had a one survey day and, people stop doing the program and then they don't feel better. Like, they start to go back and reverse back into their symptoms. That's not happening here.
Awesome. It's great. Thanks for sharing. No, those are fantastic stats that are critical, and especially it for midlife women. This is a program that can help everybody, right? Like, you talk about some of those stats I said with, different areas that impact men, but it's like 10 out of 10 women in the midlife are going to go through these midlife changes. So it's critical that that organizations step up and try to look at options. So this is great.
So what I find interesting, like a lot of decision makers are men in the workplace, and this can be an icky thing to talk about, right? Because it's like, I'm not comfortable talking about women's, the big M word, right? So what I encourage employers to think about is just think about a woman that's in your life that maybe could be your partner, could be a sister, could be a mother, could be someone that, and reflect on who she was before and who she might be now, and how you're saying, this isn't the same person anymore. She is the same person. She's just going through this transition, but she's not getting the proper care she really deserves and should have. And when she does, she feels like her old self again. And she can, just be that same human being and excel at everything she's doing like she did before. But the problem being is that she's struggling because she doesn't know where to turn. If she goes to her doctor's office, she's often left on her own with very poor answers. Either that's it, that's life, that's the way it is for midlife women, suck it up, buttercup, or it is, oh, you're too young for that, or, like there's just any, myriad of,
They're not getting the proper tests, so the proper, their hormone levels are off and not being addressed properly. You're absolutely right. You're absolutely right. I can tell you though, with a lot of the decision makers that we're speaking to, Angela, it's definitely more of a conversation today. So I think your timing is great for that, because they're looking for options, and you're right. Benefit plans, traditional benefit plans, haven't addressed the needs of so many people that are members in a benefit program.
A personal comment to say, I don't know whether it's, I know Facebook is listening and Facebook knows how old I am. So they hear my friends chatting, but I cannot tell you how many ads that scroll by that just, boom, here's the magic cream or the magic pill or the magic this. And I bet a lot of women spend a lot of money just clicking because they're desperate, right? So it's nice to have a bit of a professional roadmap, and it is great that this conversation, very similar to a couple of years ago when obviously people are more open talking about mental health. So now I among other women are encouraged by these conversations, whether it's podcasts or whether it's in a boardroom talking about a benefits plan. Rob, yeah, I'm very glad to hear that it is a topic of conversation. What will be some of your next steps, I guess, going forward? Because you as an advisor, certainly, like others, have an opportunity to distinguish yourselves in helping this population and having the conversation. So what's your strategy going forward, Rob, as an advisor?
Yeah, first of all, thanks for asking. And I would say you're absolutely right. Women are such a critical part of any or growing organization today. And Angela was like bang on when I think of a lot of our key clients and in our colleagues at Benefits Alliance, the key clients that are, directors or VPs of HR, which typically HR kind of leads out benefit decisions, that they're looking for strategies to modernize benefit programs more than ever before. And they're looking outside the nine dots that, frankly, haven't been spoken about too often, right? It's one thing, companies want to modernize a drug plan as an example, but I think when you look at a lot of Angela's key stats and where my brain's going, you talk about anxiety as a leading cause of disability and so many, there is, still a large percentage of women over men that are going off work. And, like if you're looking for an ROI, why wouldn't you not focus and look at strategies? And I think that's I think an area that companies are looking for. So I'm really glad we're doing this podcast today because I think it's relevant to a lot of people today that are making, proactive decisions in benefit programs. And for those listening, you haven't thought about making proactive benefit decisions in your program, you're behind your competition. So I think it's critical that, companies are open to it. They're looking at what are solutions they can provide, or there's certain ways they can provide spending accounts, and we've talked about that in previous podcasts, Caroline, around fertility. So this is I think it's a key metric, and I'm glad we're addressing something that's really important.
One question I have or thought is, in modernizing benefit plans, it often does mean adding a little bit more of a personalization, right? You mentioned fertility family building. We've talked about men's health. Now we're talking about midlife health. So Angela, how does this align in with what you've seen, whether it's in the UK and now coming into Canada? How does it help employers align with a broader DEI and leadership, their pipeline goals when it comes to that?
Yeah, that's a great question. I think the challenge is that a lot of employers are sitting there going, it's hard for me to have a lot of different solutions in my suite of products, right? So, how do I build a benefit plan that has all these unique health needs that a lot of my employees have and that I can afford it? And unfortunately, a lot of benefits over the years, they really haven't been able to do a very good ROI calculation on. So they make the investment, and EAP is one, right? Even digital health, like just calling in and having a consultation around a cough or a rash or whatnot. Great solutions and definitely convenience for not having, especially individuals that don't have a GP, but rather it's saving the healthcare system immense dollars because they're not filling up the ER with those types of things because they don't have a doctor. But it's also saving, having to wait in a doctor's office hours if you do have a family doc to go and have that appointment just to ask that simple question and maybe get an easy script. So I feel for employers right now because it's a bit of a challenging time. There's multiple solutions that you have to juggle. What I would say is start with your data. Ask your insurer and your advisor if they can try to get some data for you, even if it's not your own data because maybe your size doesn't accommodate it, but get the data on, look at how many females you have in your workforce. Think about how many absences you're taking, casual absences, because I can tell you there's data out there where in the UK, hospitals, 4 hospital sites implemented a solution like ours. And within 6 months, they saved £9 million in just casual absences of women taking the odd day here and there because they just weren't feeling up to it. And when they put the solution in, women were consistently coming to work and performing, and they didn't have to have replacement hires. So in a hospital setting, if somebody doesn't come to work, the work still needs to get done. So you have to have casual people to come in to replace them. And this was their return on investment. So even your casual absences, look at that because it is impacting your business. It is. Because those projects are stalling, they're not moving ahead. You know what it's like when someone goes on vacation, how things happen. Well, that consistently is happening for women when they're going through this stage. Look at your disability claims. Look at your data on drug claims and how much it's going up for SSRIs, so those anxiety and depression drugs, which is the go-to that a lot of GPs will prescribe because they don't have any other skills in their toolbox to help women through this. So that's what they prescribe. And those are highly addictive, ineffective for the most part for women. Look at your drug data on increased cardiovascular disease drugs. So these are all data points of additional costs that are impacting your bottom line because you're not addressing women's health issues. And if you effectively invest, you're going to get multiples of what we see as 300% ROI by making that investment on your return.
No, that's great. I think that's important, and people need any type of data driven. Unfortunately, due to privacy, we can't get in depth to show like what age groups maybe have made all those claims, but maybe larger organizations we can get greater
Exactly.
data.
Larger organizations should
Yeah,
be able to get the data. But then if you can't get it, then at an insurance level, they're publishing a lot of this aggregated data,
right.
right? They are. Like, look at Sun Life. They're very good about reporting on this. So you can get that at an aggregated level. I know working with Medivie Blue Cross, they're really good about sharing that data as well at an aggregated level. And you can see it, like it's glaringly obvious when you look at it, and then you go, oh, I can't believe that I have been ignoring this for as long as I have.
And how do people get more information about your company?
Well, they can just go to sanoliving.ai, and there they can download the white paper, they can get infographics, and just learn a little bit more about us. They can book a demo. There's a calculator to calculate your ROI savings as well. You can do that on there. So there's a few tools that you can use to get yourself, just preliminary educated if you feel you want to start there, as opposed to just jumping right into booking a conversation with us. Encourage brokers to come see us as well.
Perfect. And one question too, can an individual start using SanoLiving themselves and enroll for it, or does it have to be through an employer program?
So that's a great question. We didn't start that way. But what we found is when women had it through their benefits and they maybe left their employer, and then they would be like, but now I don't have the benefit anymore. What do I do? And certainly didn't want to be telling her, well, there's nothing we can do for you any longer. So we do have a consumer model. It's not anything we really heavily promote, but it is an option if individuals want to try that.
Well, this has been great. One of the things that we strive for at Benefits Alliance is to be a real advocate for our clients, and I love that you've taken such a forward-thinking approach for the advocacy of midlife women. And Angela, this has been great having you on today. So, any final closing thoughts from your side?
No, I think we covered it all, and I'm just really happy that we got an opportunity to have this conversation and raise awareness, and look forward to working with any of your advisors and brokers on supporting their plan sponsors.
Amazing. Well, I commend you, Angela, for having taken a passion And, I want to meet your husband because he sounds like he was a big influencer on helping this all come about. And for the extensive research that you did in England, in the UK, to, think about what could come over to Canada. And certainly, as we talked about, you're going to help with the, as we say, physical, mental, and financial well-being for Canadians. So thank you.
Yeah, thank you so much for joining us today.
This has been the Benefits Alliance Voice. If you enjoyed this episode, please share it with your network and be sure to check out the podcast notes for any additional materials.